Have you been injured in a car accident, been diagnosed with whiplash, and wondered what's the best treatment for this? Don't worry, you're not alone. This is a common question that many patients have, and we are going to do a brief overview and discuss this topic. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation, and I'm fellowship trained in primary spine care. Please remember, these videos are not a substitute for medical or chiropractic advice, for diagnosis, or for treatment. So let's dive into this topic. So what is the best treatment for whiplash? Well, before we jump into the best treatment, let's just define something. The term whiplash is a universally used term that usually indicates injury to the musculoskeletal system, predominantly the spine. However, that being said, the term whiplash is really nondescript, nonspecific, and it's about as accurate as saying sports injury. If I told you somebody had a sports injury, you'd wonder, well, was it a concussion? Did they sprain their ankle? You wouldn't know. However, let's just assume for the sake of this video, injury to the musculoskeletal system, predominantly of the spine. So the best treatment is really simple. Number one, you handle the inflammation. Number two, you get the pain under control. Number three, you do targeted exercises to make the body recover to the best extent possible. But let's go into this in just a little bit more detail. All right, so the first 72 to 48 hours is usually strong inflammation. However, because of the nature of injuries where there's tearing of the tissues, the inflammation can actually last a lot longer than that, especially when you think about your neck, or your lower back if that was injured. You have to use it throughout the day. Imagine spraining your ankle and then walking on it all day long. It's going to stay inflamed. So it's the same thing with the neck and the back. You can only rest it for so long before you have to use it. So while inflammation, typically you would assume it might only last for 3 or 4 days, sometimes it can last for weeks, if not months. So getting the inflammation under control is really important. Motion. Early motion is really wonderful, and it's very necessary. Now, when it comes to the spine, there's motion that a patient can do. But I gotta tell you something, it's not enough. There's another video that I did talking about, does exercise help spine pain? I recommend you go take a look at that, because the research behind exercise only being enough for spine pain, it's not very good. And here's the reason why. If I want to move my neck, I can turn it side to side like that. Now there are multiple vertebrae in my neck. I'm using all of them, so I can move an entire region, but it's very difficult to move one. So let's just say, for argument's sake, in addition to the whiplash injury, there's a disc herniation at C4-5. Well, how do I put motion that's needed for that disc to repair just exactly right at C4-5? You can't really be precise with that doing it on your own. However, a chiropractor that does targeted, precise spinal adjusting can get right on that area and can give motion into that level. So spinal adjusting, which is what chiropractors do with their hands, it does two primary things. Number one, it provides range of motion right into that area. But number two, it provides neurological input into the surrounding nerves and up into the brain. So there's a neurological mechanism that also results in recovery, pain reduction, and range of motion improvement, in addition to the mechanical changes at that level. So motion is needed. Patients need to move on their own. Also, they need targeted movement delivered by a chiropractor at those joints. So chiropractic care is very helpful. In addition to pain management, you can also do acupuncture. You can also do dry needling. Both use needles. They have two different approaches, two different mechanisms, and they're not necessarily used interchangeably, but they can be very helpful for pain control. Exercise therapy is also needed. So we already talked about patients doing movement on their own. So at the beginning, patients need to be doing just day-to-day movements, general ranges of motion. However, as time goes on, oftentimes they need targeted strengthening and conditioning movements. That being said, sometimes we have patients where they're referred out for exercise therapy, and this person was never a NFL athlete. And the therapy is the therapy that you would give to an athlete to try to get them stronger, and that's overkill. So not all therapy needs to be very extensive. Patients sometimes want medication, and as a chiropractor, I can tell you there's plenty of medical providers that can provide medication. So do your own due diligence and find somebody who can. So when somebody is injured, inflammation control, Range of motion improvement. Adding motion into the joints, both passively, that's from a doctor doing it, actively from the patient doing it. Progressive strengthening, using some medication if needed to kind of help with the recovery process. And then screening for really difficult and complex conditions that may require more management. So remember, there can even be some red flags of serious things going on underneath the surface. Even as you're recovering, if you develop vision issues or you develop other changes that would be neurological, those need to be brought up to your doctor. So recovery guidelines, how long does this oftentimes take? Well, it depends on how many levels are injured, how extensive it is, the biology of the patient, how old they are, how old their tissues are, how young they are, how healthy they are, if they're able to do everything right, if they smoke, if they don't smoke. There's a lot of factors that go into it. Generally speaking, a really mild injury oftentimes can take several months. Moderate ones can take up to a year, and severe ones can take longer than a year, and sometimes they just never fully recover. So the best treatment is early motion, inflammation control, pain reduction, whatever it takes, return to activity, and progressive strengthening. So I hope that gives you an idea of what is required for best treatment for whiplash. We try to follow the best treatment here in our practice. If you were injured and you live in the St. Paul, Minneapolis area, we're here to help you. If you are looking for somebody else and you're not living in this area, we hope that these general guidelines give you some ability to take a look in and around your community and find somebody who can help you. So remember, your provider needs to have the training, education, experience, skill, and knowledge to be able to handle the type of injuries that you have. If you're not improving, you need to dig a little bit deeper. You have a lot of videos to watch. I am honored that you chose this one. I thank you for your time, and until we meet again, have a wonderful day.